Hi, Dr. Paul here today at Elevated Health. We are in the peak of flu season, not only here in Southern California, but across the United States. So I want to talk a little bit about the flu today and just give people a few things that they need to be on the lookout for. So first of all, when we're talking about the flu, we're talking about the actual influenza virus. So a lot of people use this term generically whenever they're sick this time of year. But we are talking specifically about the influenza virus that occurs throughout the United States and actually the world this time of year. So the influenza virus is spread via what's called respiratory droplets. And so essentially that means when someone coughs or sneezes, this virus is present in the aerosol that is released from the system. If you're in close proximity to that person and you inhale that, you can potentially get the infection within the next 2 to 4 days. So the symptoms of that particular infection will start very rapidly after you become infected with it. And typically the worst symptoms that you'll see is a fever, usually well over 100. You'll have a really bad headache, body aches, and even fatigue. Respiratory symptoms are very common as well. Those usually include things such as cough, sore throat, nasal congestion, head congestion. So we have the diagnosis here for the flu at Elevated Health. It's a very easy test that we do. It's a nasal swab. It involves taking something like a Q-tip, rubbing it around on the inside of your nose, and then usually within 10 minutes we can come up with a diagnosis. So as far as treatment, we also have all the treatments available here at Elevated Health. We have an exciting new treatment called Influenza, and it's actually a single dose treatment. So it's one tab, one time, which will treat the flu. And then of course we also have Tamiflu, which has been around for years. It's a 5-day treatment, twice a day, but it works very well for the flu. All these medications tend to decrease the symptoms by about 2 days. The important thing is that these medications need to be initiated within the first 24 to 48 hours of developing symptoms. So I think it's important to note that not everyone needs treatment for the flu. Healthy people, obviously, they might be miserable for a few days, but they don't necessarily need to be treated for the flu. Really young children who have underdeveloped immune systems, or say elderly people or people with chronic diseases like diabetes, heart disease, lung disease. These are people that can suffer the complications of a flu, such as pneumonia and potentially even death if it's not recognized and they're not treated soon enough. So these are the people that it's really important to have come in and get tested and make that diagnosis. So again, here at Elevated Health, we have the vaccination for the flu, we have the diagnostic testing for the flu, and we also carry the treatments right here in our office. So we actually hope that we see none of you for the flu this time of year, but if you're developing any of these symptoms, be sure and get in so we can make the diagnosis and determine if you're a candidate for treatment and get you the help that you need. So thanks, and let us know if we can help you.